Hello and welcome to More to the Story with Molly White. I'm glad you joined me again today. And this is part two of our discussion of the dangerous abortion drugs. And my special guests are experts in it, Dr. Donna Harrison and Chris Gasick, and a doctor and an attorney. So you want to stay tuned. You want the rest of the information. And I do encourage you to invite others you know to listen in or share this link with them, everyone that you know, because this information needs to go across the country. It really needs to go across the world because when you get informed about these dangerous abortion drugs, women are not going to want to take them. And we'll probably put pressure on in trying to get these things off the market because they're so dangerous. But before we get started, I just want to give a shout out to our show sponsor, Dr. Stephen Hotze with the Hotze Health and Wellness Center. I go see him. He helps me stay healthy, and I encourage you, if you want to stay healthy, you might want to give Hotze Health and Wellness Center a call. And now I'd like to introduce Mary Browning, my awesome co-host. Come on in, Mary.
Thank you, Molly. It's so good to be here and for part two. As you mentioned, this is really good stuff. And I want to mention, too, that we have Julie Blake on the show as well. She's an attorney with the Alliance Defending Freedom. They are the group that did take the action and file on behalf of on different plaintiffs that included Dr. Harrison and challenged the approval and other things that FDA did related to the chemical or the abortion drug. So we are thankful to have her on the show as well.
Yes, amen. So we have Dr. Donna Harrison, who is the head of the research division for the American Association of Pro-Life OB-GYNs. Is that correct?
OB-GYNs.
And then we have Chris Gasick back with the Family Research Council. And if y'all would come in and say hello, and Julie, you as well, make sure we're all... Terrence wants us to give a shout out warning about our topic today.
Yes. Yes, we will give a warning. Do you want me to do that, Molly?
Yes.
Yes, so our topic today will touch on abortion, and there'll be some details, not specific of individuals, but there could be some harm of abortion. If you have abortion in your past, you may find yourself with an emotional reaction. We sometimes call that being triggered. And you could contact the H3 helpline. We would encourage you to call out for help. That's 866-721-7881, or log on to operationoutcry.org, and there are healing resources there. Thank you. Thank you, Terrence.
Thank you. Yes, thanks for the reminder, because this can be a really triggering subject. So Dr. Donna Harrison and Chris Gasick and Julie Blake, welcome to More to the Story with Molly White again.
Thank you. Good to be here.
Nice to have you. So we ended by talking, Dr. Harrison, you probably remember the 3 points that you wanted to continue on the discussion. So I'm going to let you jump in there and say it.
Okay. I'm going to backtrack a little bit. So the biggest concern with the abortion drug is the issue of it's not safe for women. We know that it kills most of the time the human being inside the womb, but we also know that it hurts women. And as Chris Gasick mentioned last time, 1 in 25 women who take this regimen end up in the emergency room. That's significant. And some of the dangers and harms are the issues of tissue left inside, major hemorrhaging, because mifeprex, the first drug, actually keeps the uterus from contracting, the spiral arteries from contracting. The spiral arteries are what feed the baby. Mifeprex actually keeps those from contracting, so you can get some massive hemorrhage. In fact, in the clinical trials in Iowa, there was a woman who had lost almost all of her blood volume very quickly from hemorrhage. And when that was reported, the complication was dismissed because it was expected. So they only wanted to talk about unexpected complications. So this is the callousness with which this drug has been treated. So some of the immediate complications are bleeding, infection, like the 2 women that recently died after taking the chemical abortion drug. And by the way, one of those was in a state with a very liberal abortion law, not conservative abortion laws. So we've got those, but we've also got other issues that make the abortion drug even more unsafe the way it's being distributed right now. Because when the FDA originally approved it, the women in the single, non-blinded, non-randomized, non-controlled trial, the women all had an ultrasound. They all were within an hour of the hospital that could give care, and they had physicians who were able to do surgical completion. They could do a DNC. Now, what has happened is that women are getting these drugs through the mail. They don't know how far along they are, and why is that an issue? Because the only way you can tell how far along you are with accuracy is with an ultrasound. And if you don't have an ultrasound, then you don't know. You may think that you're 6 weeks along, and you may be 12 weeks along. And the issue is one of informed consent. It's every woman's right to know what her specific risks are before she's given a drug or a medication or any kind of a treatment.
Right.
And her risks at 6 weeks are very, very, very different than her risks at 12 weeks. At 6 weeks, maybe 1 in 20 or 25 women will have to have surgical completion. At 12 weeks, 1 in 3. 1 in 3. Okay, so without an ultrasound, you can't give a woman informed consent, and that is malpractice. That's malpractice. Okay,
Yes.
without an ultrasound, you can't tell whether the baby's in the womb or not. We know that around 3% of women who are pregnant have the baby that's outside the womb, in the tube. That's called an ectopic pregnancy. And the problem is Mifeprex doesn't treat ectopic pregnancies. So when you take Mifeprex and you have pain and bleeding, severe pain and lots of bleeding, and you call, and this has happened to women who have had this, you call and you say, I'm having pain and bleeding, and they say, honey, lay down. This is normal part of the procedure. Well, there have been women who have died because they had a rupturing ectopic pregnancy that wasn't diagnosed because they didn't have an ultrasound, and they bled to death internally.
Wow.
And that is a problem. So it's absolutely critical that a woman who's going to have an abortion have an ultrasound for informed consent, so she knows that where the baby is. And sometimes the baby's already died, and that's a miscarriage. And then if you don't know that, then you go through your whole life with the burden that you may have done an abortion, and maybe the baby had already died, and maybe you aren't responsible. I know women who have grieved for 20, 25 years only to look back at their records and find that the baby actually wasn't alive at the time they took these drugs. And so for her own mental health's sake, that's an important thing. So the 3 reasons why you should have an ultrasound, but there's even more. Every woman who is Rh negative, that is, who has a blood type that's O negative or A negative or B negative, those women should have a medicine called Rogam. Rogam is a medicine that's given to Rh negative women that prevents them from forming an antibody response to their baby, okay? Because the baby's blood mixes with the mom's blood real early, and Rogam prevents that. Why is that important? Because in the next pregnancy, if she has another baby that she wants to keep, her body may mount an immune response, and she may lose that baby or have significant complications, sometimes requiring transfusion for the baby in utero. That's called Rh isoimmunization. And that happens to women who don't get Rogam. But right now, women aren't getting Rogam when they get the pills through the mail, when they don't see a doctor, when nobody's testing them. So this is all such a violation of women's rights, even if you don't care about killing the human being in the womb. You should care about informed consent. And you should care that women have risks, and you should care not to harm them and decrease their chances of having babies in the future. So all of these are issues with the way it's currently being distributed.
So Donna, you
And you
shouldn't
should
blood
care,
typing
hold on,
be
real
a
quick. You should just care about your own physical health as well. I mean, like you said, Donna, even if you don't care about the baby in the womb and you want to have the abortion, you should care about the risks involved to your own health. It could be life-threatening. So go ahead, Chris. I'm sorry.
No, I was just going to ask, so if a pregnant woman comes to a doctor's office, is she normally blood typed?
Yes, that's
Okay,
a routine part of
Right.
the prenatal care.
So you have a pregnant woman coming to this process, and she's not being blood typed.
That's right.
Correct.
That's right, because she can go online and have an online consultation, right, Dr. Donna?
That's correct.
With someone that says they're a doctor online, but never have a blood test done or an ultrasound done.
Right.
And like
And
Mary has said before, what is it, Mary? What's the statistics of how wrong women are when they come to fetal gestation?
I think it's 50% of the time. We know that now, that
We
women,
think
and I
we
would
know how
assume,
far along we are, like, and we really don't. Mm-hmm.
and we're talking about women, but we're also, this drug is available to girls as well, or it's available to anyone. So while we're talking about women, we really want our listeners to know that this could be happening to girls in your neighborhood, even today, even now, while we're talking. Your neighbor girl could be having an abortion in her home, that the boyfriend may have gotten the drug for her. It's possible. They're really, and I guess that brings us to the point as we're talking about the litigation and Doctor, you being sort of the head of the organization or one of the organizations, or maybe two of them, or former head, that brought the action, that ADF really brought the action on the behalf of you all and other organizations. This is really why, I guess, the core of this is why. And I don't know, Julie, if you want to speak to that, when you all brought the action, what were you looking at?
We were thinking that women deserve a doctor's care when they have high-risk drugs. We were looking at 1 in 25 women ending up in the emergency room every year for serious, life-threatening complications. And these women deserve better than this. And so, although we're disappointed that the Supreme Court dismissed the case on a technicality, there are 3 states that have already intervened and filed a complaint challenging the FDA's just reckless removal of safeguards on these drugs.
Amen. Well, we hope and pray that we get justice on that for women across the country. I'd like to sue them myself, and we've had women on our podcast that have had chemical abortions, and one young woman, she was a teenager, she was given the drug, parents didn't know, and she said she had a little bit of bleeding there, and that was it. And she thought, okay, well, that's all there's to it. Well, it was a month later, she started hemorrhaging in school. And then her mother had to come get her, and that's when she lost her baby. So can you speak to that, Dr. Harrison? That this drug always, and maybe she was further along in her pregnancy. She doesn't know, but it didn't take effect right away. It was a month later.
well, I don't know that particular case, but I can say that women can bleed on average for a month, and they can partially pass tissue and leave the rest inside. That puts them at high risk of infection. Serious, life-threatening infection. So this lack of follow-up care is just awful. But there's something else that that you kind of touched on, Molly, and that is women are taking these drugs and then they're alone. And they're told, oh, you just have a little bit of tissue here and flush, don't look, and all this other just horrendous stuff. And they pass a recognizable baby. There have been people calling pregnancy care hotline saying, I have my baby in my hand. Baby's dead. What am I going to do? And they're told to just flush these babies down the toilet.
Well, not the helpline numbers aren't telling them that.
No, the helpline numbers aren't telling them that, but they're told by the abortionist so that the helpline numbers walk them through. And imagine the trauma of being in your bathroom and having this abortion that you think you're just going to see a little bit of blood, and what you see is a recognizable baby. And then ever after, when you walk into your bathroom, what you see is that baby. This is horrendous emotional abuse, actually. And what's even worse is these women are not told. So this is another area where they're violating informed consent. They're not telling these women, look, you may see a baby with a head and hands and feet. Women are not prepared. And the reason I say that is because I'm in touch with people from different pregnancy care hotlines, Heartbeat, NIFLA, CareNet.
Yeah.
And they're getting these kinds of calls from women who were not told. And I think it's time that the women who did not receive appropriate informed consent, like you, Molly, I think it's time they speak out.
It is not only time they speak out, but it's time they sue. I want to sue. It's medical malpractice. It is false and deceptive trade practices from the medical industry when you're not giving someone full consent. Why wouldn't you give someone full consent? Because they might walk away and not give you the money and have the abortion. I mean, it's criminal to me, and it's something that really gets my blood pressure up if you haven't if you haven't noticed. But the important thing is for our listeners and our viewers is this dangerous drug was never tested properly. It went through the fast track of approval. It's in fact, I think Dr. Harrison told me that Danco's the manufacturer, but they farm it out somewhere else to be produced. Is that correct?
That's correct.
And so who knows who's producing this drug? Is it someone in China, or someone who could care less about the American population? And then then you can't hold the manufacturer accountable for the drug because it's produced somewhere that we don't even know where it's being produced at. So
I mean, they're more like a distributor, right? I mean, and this goes back to the sort of the kind of the secondary or third level, clown car company that Danco is, right? It was just stood up by the Population Council. Population Council had no experience as a pharmaceutical organization. And our understanding is that the original, when the approval was coming, and I don't know how long this continued, we don't really know these things. The chemicals came from China, back in 2000. So, and how, what was the purity of the, the quality of that. And, but anyway, so they don't they're not making the stuff, right? So they're sort of, they're at a secondary sort of stage of this. They're just sort of packaging it and then distributing it in the United States according to certain regulations. Some of them have to do with the Subpart H, principles, but the whole thing is just from A to Z. It's just kind of crazy town, I mean, it's it's totally political, right? This is a thing that the government of the United States wanted to do, and they wanted to force this into the market of the United States, and that's where we are.
It almost seems like Danco is the straw man for the Population Council. Would that be an apt description, that the Population Council?
Yeah, Danco's kind of, I would say, almost more like it's almost more like a straw man for the United States government.
Wow.
I mean, right? I mean, I don't know, Donna, would that be, totally unfair? I mean, this is the government product. I mean, this is, two Republican administrations haven't really been able, either tried or really, whatever. I don't want to go down that road, but, have not rescinded the approval. It would probably be tough at this point, because one of the things I just sort of a sidelight is that there is a sort of an abortion industrial complex, an abortion industrial academic complex, and it also includes publishing. So you have this sort of fake set of journals, these fake, these medical schools that are sort of specialized in cranking out these pseudo studies. I sort of say this as from the side, looking at them, right? This is, and as we saw, in 2000, we've all sort of seen a kind of a, sort of a modern version of, what studies can be done that are sort of generated, and they're not real studies, right? And so that's what you see happening is, they want an outcome, and they'll go and they'll find women in Guatemala or Ghana or whatever, and they'll have these tests done over in these other countries where the regulatory and ethical controls aren't as great. And this is true, I think, within a lot of the entire reproductive health, area. But I mean, I don't know, Donna, I mean, maybe I'm sort of overstepping, but why don't you?
I can't say in general. Okay. I do know of one study that was done where they didn't use an ultrasound, and this was done over in Nepal, and they didn't do any kind of pre-testing, and they said that they had a 98% success rate. But when you dig into the study, it was 98% of the women that came back had a success.
Oh.
They didn't tell how many women didn't come back. So
that might have
it's this
died.
kind of manipulation stuff that's really, it's really challenging. But I can't dismiss all the studies as being bad. I can just say that whenever you see a study, you can't just read the beginning and the conclusions. You actually have to dig into how they did the study. Did they lose a lot of women to follow up? So, for example, there's this one data set that has generated umpteen studies out of it. I mean, multiple studies. And in that data set, they lost over half their patients to follow up. So the only patients coming back are those that have a good outcome. So of course, it's these kinds of
Yeah, the rest of them are either in the emergency room or they've,
in this case, it was a mental health study. It's called the Turnaway study. Okay. So if you look into the details of the Turnaway study, which a lot has been talked about, you'll find these kinds of shenanigans. So, and I can't say it's every study, but there are some that are just stunning.
Right.
Doctor, I have a question, and you mentioned it earlier about the ROGAN and the RH factor, because a lot of the women that I have met through Operation Outcry and through the work that we do have never been able to have a child. And so I don't know if there had been any studies that really looked at the number of women or girls who had their first child aborted and didn't get the ROGAN.
Well, it turns out that I'm part of a study group with the Charlotte Lozier Institute, and we've looked at the data from Medicaid across the country. And we've done some interesting work. We've got about 6 or 7 papers out there. But one of them was looking at first pregnancy outcome and then subsequent reproductive history. And it turns out 1/3 of women who abort their first pregnancy never go on to have a live birth.
Wow.
Whereas that's significant.
It's significant. 1/3. Whereas 2/3 of women who have a first pregnancy birth never have an abortion. So the abortion industry wants you to think that, women have 2 babies and then they abort and they go on to have a 3rd baby because of this time. That doesn't happen. It just doesn't happen. What happens is that first pregnancy sets a trajectory for that woman.
Yeah.
If she aborts that first pregnancy, she is much, much, much more likely to abort a second and third if she's even able to get pregnant.
Yes.
So it's very sad and sobering. And if anybody is listening and they have their first pregnancy and they're thinking, oh man, I just don't know if I can handle it, there's resources. Don't abort. Right. It will change your life in ways that you will suffer for, you may suffer for a long time.
Amen. I can attest to that. I've been speaking out about my own abortion for 25 years all over the country in every different kind of scenario, and I have never seen a positive outcome come from an abortion, not once. So there are, motherhood's the best, and there's always help for you. And please don't take this dangerous abortion drug, and don't let anyone else take it as well. Well, we have a question from my producer. So, Julie, please update us on what are some of the legal challenges that are the common arguments against regulating the use of the abortion drug. And so, what are the common arguments against regulating the use of the abortion drug?
Well, the main argument that was advanced against doctors like Dr. Harrison, was simply a technicality, that they weren't harmed enough, that their patients weren't harmed enough to be able to sue. But that's simply not based in the science. Not with the ER rate. The ER rate on the FDA's own label says 1 in 25 women who take these drugs will end up in the emergency room. And as we know, those are for serious complications, severe bleeding and other really dangerous infections in the emergency room. And, the truth is the FDA never had the authority to remove these safeguards, to take away the guarantee that a woman have the ongoing in-person care of a doctor, to take away requirements that she get follow-up care to make sure that there's no complications. The FDA removed safeguards, even saying, hey, report complications when they happen so we know if people are being hurt or not. All of these safeguards were really important to protect women to make sure that when they're taking a dangerous drug like this, that they've got the ongoing in-person care of a doctor. And that's what the science shows is the best care for women. I think we should all be able to agree that a woman deserves a doctor's care. I just, frankly, it's not a lot to ask.
It's not. You get that kind of care in any other situation medically. You always have your doctor and follow up. And if you have to go to the emergency room, more than likely your doctor is going to go there and make sure you're taken care of and take care of you, whatever it is. But that doesn't happen in the abortion industry. The abortionist never does follow up care. The abortionist will never follow you or work with the ER if you have some kind of complications. It's just mind boggling how the abortion industry can get away with such abuses.
Well, Molly, one of the things that goes back to the original approval, and we raised it in the original citizen petition in 2002, but was a point that Donna was adamant about, which was that the doctor who prescribes the drugs should have admitting privileges at a hospital, relatively nearby hospital, and should take care of the patient, right? It's exactly this point. And the FDA fought that requirement tooth and nail and has always fought it. And it's not in place, obviously, right? Because what they've done is they've pursued a hyper deregulated regime for administrating the judge for the drug, and then creating this downstream, basically a sort of ER dumping model. That's the regime I was talking about in the first part, right, of the first episode. And so FDA absolutely, knows what it's doing. It absolutely created this world that we live in. And what Julie's saying was right on the money. And what you're saying is that people have a right to be cared for by their doctor. But FDA never agreed. And it's one of the really horrific aspects of the whole approval system, that if you have something that's sending 1 in 25 women to an emergency room, a rational person, if you were sort of a rational regulator, if you're sort of, hypothesizing what would that be like, you would be more stringent. You would take care of these things ahead of time, right? But that's not what they did. And I know, Donna, I know that's a big point for you. So.
Yeah, oh my goodness, Chris, I'm so glad you brought it up. And I think it's important that people understand what happened when FDA started to deregulate, as you were mentioning, Chris. So originally in 2000, the manufacturer was responsible for reporting any complications to the FDA. And in 2016, they said to the manufacturer, you don't have to report complications anymore. You just report deaths. And by the way, we're going to change the whole regimen so that you can dispense without an in-person visit, that she doesn't need a second visit, that, they changed it all. And then, so remember, 2016, you're only getting deaths reported to the FDA. And then in 2020, with the whole episode with the COVID deregulation, where they allowed mail order drugs, they had the FDA had the audacity to say, we looked at our adverse event reporting system and there weren't an increase in reported adverse events, and so we know it's safe. I mean, it's like, you got to be kidding me. I couldn't make this up,
Right.
They designed the system to not capture any adverse events. At the same time, they loosened the regulations and then used the lack of reported adverse events to say it's even safer now. So it's just crazy. It's crazy.
So in 2016, you had a major modification of the regulatory regimen that was in place. I mean, the safety, things were just taken away that were so important. So what she's saying that's so interesting here is, at the same time they're doing this, instead of sort of, right, the regular, a rational person would say, we're changing all kinds of things about the system. Maybe we need heightened scrutiny and reporting because we've changed so much. We want to know whether this is safe, right? I mean, that would be how a rational person would care about somebody, might do it. But instead, they basically gutted the entire thing and only had the reporting of deaths. So, I mean, you can see that the fix is completely in here, right? And let me just say, that was the Obama administration that created that major modification. It was in 2016, again, right as the administration was going out of office. But Donna's completely correct. I mean, is that a fair point, Donna? I mean, it's really just, it defies not just, it defies rationality that, or any sort of notion that what matters here is the well-being of the women involved. What matters to them is having a dead baby.
That's right. That's right. That's the
And
two contrasts.
That's what
Right
it's all about.
What I'm hearing is the FDA and Population Council and all those, they care more about aborting babies, getting these babies aborted, and protecting the abortion industry in the process than they do about human life, the life of the mother, the life of the baby, the health and well-being of both. That's what I'm seeing. And then they're passing down all the responsibility
Right.
of these health risks to emergency room doctors and doctors who are never involved in this abortion process in the first place. That's how I'm seeing it.
Yeah, you get an
All
A+.
passed
That's exactly
downstream.
what.
Mhm.
Well, that and to the women who then are left with disposing the human remains.
And there's
Because
no
that is the other
regulation.
piece that,
Yeah, there's no regulations on that. And now we're having, human
well,
babies being flushed down the toilet into our
well,
septic
there are
system.
some regulations around that, but I think it's the abortion industry that's been regulated on what to do, that and the medical profession. So when you pass it off to an individual in their home, I don't know if each state has regulations related to that. I know New York just lifted all of their regulations related to disposal of human remains.
Mm.
So in terms of how callous, how much more callous can we get in this arena? I mean, one has to wonder. I know, Doctor, you used that phrase earlier, and it just really strikes at the core. We have, and I think it was in the earlier podcast that Molly had mentioned, we'd done one, I believe it was in March with Dr. Harrison. And even though I had written a brief or had been one of the writers on a brief and understood it well, it never dawned on me that the FDA had removed all of the protections until that conversation with Dr. Donna before. And so this is what the public needs to know, is there are no safeguards for women and girls related to, never mind the fact that disposes of a baby, if you want to jump over that piece, there's no protections for the women and girls anymore at all. And there was in the beginning, even though the whole process was built on a house of cards. Now we're just compounding that house of cards decision and the tragedies from that. So,
Well, we're about out of time. I hate to close because it's so informative. But is there anything that you would like to conclude with, Dr. Donna and Chris, before we end?
Yeah, if anybody is really interested in digging into the details, Alliance Defending Freedom has the case reports, the information from the case that was recently filed with the FDA it went before the Supreme Court that was dismissed. And in the complaint, that's the document I'd like you to look at, all of this history is outlined. And there's also, Chris, I don't know if FRC has on their website, Family Research Council has on their website the original citizen petition, but that will also give you the history to dig into in more detail than you probably ever would want to know.
Good. Thank you. Thank you.
Yeah, that website is adflegal.org. That's adflegal.org.
Great. And then you said Family Research Council, and what was the other website?
Chris, do you know, does Family Research Council have the citizen petition on?
I don't think we do.
Okay.
I'll see what I can do about that. But I'll also, one of the things I'll do is I'll send the citizen petition and there's a follow-up to it. The appendices, I'll send it to all of you. So you can at least try to figure out somewhere to get it to the, online and everything. But
Great. We'll add it. Yeah, we'll add it to this.
Yeah. No, this has been a terrific show. This has been fantastic. And I think you, Molly, you kind of summarized, or both of you, you and Mary both summarized sort of where things are in a way that's stark, but it's accurate. And it also, in a sense, kind of shows us where the Supreme Court left things, which was, a very unfair reading of the effects of this on the emergency room doctors, in my opinion. So,
Absolutely. We were all shocked. We were just all shocked. You know, and as a woman who's been hurt by abortion, and as a woman who's heard the testimonies of thousands of women who've been hurt by, you know, surgical abortion, chemical abortion, it was a slap in the face. It was so shocking that they had that ruling, and it just kind of like, I mean, you really don't care about women, you know. So, but we're not done. We're not done. We're going to seek justice for women,
Well,
and
and these three, I think it's three states, right? I mean, they have, you know, a different set of claims, right? And they're different, you know, there's going to be a whole range of, you know, discussions of, you know, of those claims and, you know, whether they have standing. But I mean, we're not supposed to we're not going to get into that, but and that's a different, you know, far off
that's
subject. But, you know, one of the things I think that the states, you know, I mean, as we've seen, 25,000 women a year are going to emergency rooms. Somebody is paying those costs, right? And unlike the costs that are shifted onto the doctors, I mean, there are other places that pay for abortions of people, right? You know, it's interesting. I don't know that there's ever been a hearing on, you know, if you're one of the women who had one of these, you know, if one of the ER visits, who paid for your abortion? How much was it? Did you have to pay for it out of pocket? Was it part of insurance? Or, I mean, what was the code that they coded for? You know, I have no idea. I mean, I think it's a really important topic.
Amen.
I think it is.
Yep, something that
Especially
we
as
will
we-
bring you back on. Go ahead, Mary. I'm sorry.
I was just thinking, especially as that we know that with some of the drugs, when they are mailed and sent, it actually says if you end up going to the ER, this, you know, you can say you're having a miscarriage. So I think there is intentional misleading in the medical profession and the data. I don't think we'll have good data, but it would be interesting to see what is available.
Mary, we've got a study from that Medicaid group that showed up to 60% of the women who come in with spontaneous abortion had actually had Medicaid pay for mifepristone and misoprostol a couple weeks before. So
Wow.
you're talking about massive deception, and those women that lie to the ER doc, the data shows they're more likely to get admitted. They're more likely to have a significantly more serious complication than if they had just told the ER docs flat out, look, this is a complication of a mifepristone abortion, a chemical abortion. So it's hurting women to lie. And the abortion industry doesn't seem to care. They want to cover their tracks.
Yeah. Well, it's a shame, and it's something that we are very grateful to have people like you, Dr. Donna Harrison, and Chris Gasick, and Julie Blake, and many others out there who are standing in the gap and trying to seek justice for this wrong. And I certainly want to continue this conversation another time, but we're out of time. Thank you. Thank you so much for taking time to be on More to the Story with Molly White. Thank you, Mary, for helping me get this podcast going. And thank you all for listening in on More to the Story with Molly White. Please share this link far and wide, both part 1 and part 2. We'll see you again next time. God bless.
Bye-bye. That was wonderful.
Thank you.